Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. Our guest is returning to speak with us about biomarker testing, the crucial need for increased education among patients, caregivers, and those who are paying for health care when it comes to biomarker testing. Welcome back to Health Professional Radio, Dr. Suman B. Rao.
Thank you very much, Neal. Thanks for having me.
When we were here before in other segments, we were talking about biomarker testing. Talk a little bit about your background. Tell our listeners about yourself and how you came to be involved in this groundbreaking, recently, in the last 20 years, recently developed technology.
Sure. So I graduated actually in 1999. I finished my fellowship at that point, and then worked at the university for a couple of years at the University of Texas in Dallas, and then I did join a hospital-based practice, and that's actually worked out very well for me. I like where I work because of the fact that while I see a number of patients, most of my time is devoted to patient care, but we do have a lot of clinical trials that are available to us to enroll our patients in. So we've been a very active clinical trials program right since I joined, and I've been very active with the clinical trials, especially so with lung cancer. So that is where a lot of the biomarkers, the development has been, and it's certainly fascinating. I think one of the reasons I went into oncology was because it was always so cutting edge. You had to keep up, and the molecular biology has always been very interesting to me. So biomarkers, we did some of the clinical trials early on with drugs that were targeting EGFR mutations. We've done clinical trials with drugs that are targeting other mutations, and more recently we've been involved in the clinical trials with the immunotherapy pathways. So that for all that and knowledge of biomarkers, how they work, what the drugs are targeting, and the side effects are really very important.
How easy to understand is this technology from a patient standpoint?
Yeah, so it is. I would say it's variable. We have actually, I think patients are much more savvy today than they were a few years ago, and I do have patients who come in and say, well, I want immunotherapy, and sometimes it actually is incumbent then on the physician to say why the immunotherapy is going to be useful or why it's not going to be useful and what else we're going to look at. So it's still, the knowledge may not be as widespread as we would like it. It really is going to depend region by region. I would say that in my practice, it's 50-50. I have patients who are very savvy, come in prepared, know what they're talking about, and then we have patients who really need a lot of explanation as to why we're doing what we're doing, why the testing is important, why we don't rush in and treat the next day because there's a lot of urgency with the diagnosis of cancer to say, I want my treatment tomorrow. But then you have to explain to the patient that this biomarker testing is very important, and that having the right, looking at the right test, finding the right biomarker, then we can help choose the best treatment for them. So education is definitely key to that, and the website, the testtalktakeaction.com really helps. Is I think a very useful website for patients to go to learn more about this, so they can go in prepared. As far as is it widely known in the community, I think it's variable. In our practice, we routinely test everybody for biomarkers. Everybody with lung cancer diagnosis that is a stage 3 or stage 4, we routinely test them for these biomarkers. So we have that on hand often when the patient sees us, but I don't think that's the case everywhere. So the more we push to make this information more widely available, I think the better.
Sometimes, I guess, driving awareness further or deeper into folks' minds involves a sense of not just yourself as a patient, but some of the other patients that may benefit from this technology that you're currently considering. Talk about the impact that lung cancer has on the country and why it's important that patients get on board and really try to understand and spread awareness of this new biomarker testing.
Yeah, unfortunately, lung cancer is the impact of lung cancer is pretty big. We still see about 225,000 patients diagnosed every year in the U.S. with lung cancer. That's one of the top cancers that affect patients, and it is the most common cause of cancer death, both in men and women. And sometimes I think we forget that women can be affected as much as men. Although the incidence may be a little bit less, but it is the number one killer from cancer for women also. So it is unfortunately still takes a big toll on the patient population.
Now, once again, tell our listeners about the Test, Talk, Take Action initiative, the website where they can get more information, and just a little bit more about this campaign.
So the testtalktakeaction.com website was developed by Merck and support groups, patient advocacy groups. That it's basically geared toward helping patients, caregivers understand the impact of lung cancer and to have the right resources when they're diagnosed with lung cancer, so they can be empowered to make those to discuss with their physicians the importance of these tests and what the right treatment is for them. I think the important part of it also has that it has a lot of information on advocacy groups, where to get support financially, emotionally. This is a huge burden on patients and their families, and so it also provides the support sometimes that's needed for that.
Thank you for coming back and talking with us again, Dr. Rao. It's been a pleasure.
Thank you. I was glad to be here.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Suman B. Rao. And she's been in studio today with us talking about the importance of more education about biomarker testing. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.